Lesson number 15, Understanding High Deductible Health Plans. Hi, it's Mike. How are you doing today? I hope you're doing well. Thank you for coming by. It's good to see you again. We're finally getting into it, ladies and gentlemen. High deductible health plans. These plans have been taking America by storm. Many millions of people throughout the country are now using high deductible health plans, along with the HSA option that we discussed earlier in class. It's important to remember that high deductible health plans have benefits, and they also have some very sticky problems associated with them as well. Advantages and disadvantages, so to speak. A deductible, as you remember in class, is a fixed dollar amount that is specified by the plan that individuals must meet. It's an out-of-pocket expense that must be met before eligible expenses will be paid by the plan. We've gone over that in class, and you can go back to our earlier lessons and take a look at that and review the definition again. If you're covered by a plan with a high deductible, what you're really doing is you're swapping out a lower premium, the amount that you pay the insurer per year, and you're getting far less in benefits. That's the reason for the high deductible. Keep in mind, though, that not all high deductible healthcare plans, like we talked about in the HSA lesson, not all high deductible healthcare plans can be used with HSAs. That's why it's very important, and it is extremely vital that you make sure that your high deductible healthcare plan is HSA approved. That is essential. How do you even know if you have an HDHP? I'm just going to say, for the sake of time, HDHP. High deductible healthcare plans, HDHPs, usually offer lower insurance premiums. They also have different names. They can have different names. As you look at the product lineups of various insurance companies, you'll see it can be a PPO plan, which is a preferred provider organization. It can also be an HMO plan, which is a health maintenance organization, or it can be a point of service plan, which is a POS plan. It can be a variety of different things. Usually, it will be a preferred provider organization, a PPO plan. That's usually what they'll be called, but they can be called other things as well, so be sure to be on the lookout for that. Make sure you look at what's called your summary plan description to see exactly, one, what the plan is called, two, what the plan delivers as far as healthcare services, and three, what the out-of-pocket expenses, what the copay is, the co-insurance is, all those other things. You must know your summary plan description. I cannot say that enough. I can't even come close to saying it enough. HDHPs usually do not cover services and prescription drugs until the deductible has been met. Now, some HDHPs may cover preventative services and programs. Some, not all, but some. Once again, you have to check your summary plan description for that. Make sure you understand that. HDHPs can vary wildly from one position on preventative service and drugs to another. So what you must do is make sure that you understand when the deductible kicks in, first of all. Well, yeah, you know it kicks in at the beginning, but what parts come out of the deductible and what parts do not come out of the deductible of your healthcare plan. That's essential to know, because the last thing you want, especially if you're in the beginning and you're trying to fund an HSA, or you're trying to learn about your HDHP and a plan, and you're saying, well, I don't exactly know what my out-of-pocket expenses will be. Now's a good time to start reading that summary plan description before you get big out-of-pocket expenses and you don't have enough money in your HSA to help you with it. Also, please go back to our lessons about HRAs, FSAs, and HSAs to make sure you understand the basic concepts, because when you get your first HDHP, it can be very confusing. So make sure that you bring the parts together correctly. The HDHPs can work with an HRA. It can also work with an HSA. We've discussed those topics previously in class, so if you have any misunderstandings or doubts about them, please review the lessons. Know before you go, always. If you are looking at the statements, the explanation of benefits that you get from your insurer, you'll have a pretty good idea of where you are as far as meeting your deductible goals, what outlays you're putting out, and if you've met your deductible, what outlays your insurer is putting out. Always keep and review your explanation of benefits from your insurer. We've talked about that in previous lessons as well, so please review those lessons also. Make sure that you stay in network. Make absolutely sure that you stay in network as much as possible. Talk with your provider and see if you're still under the deductible portion of the program. Make sure that you talk with your provider if their fees are getting too high and you're having a hard time with the deductible and you don't have any money in your HSA and you're trying to keep your head above water. Make sure that you talk with your provider and see if you can work out an arrangement with the fees. See if you can work out some sort of agreement. See also, as far as drugs go, see if there are less expensive alternatives like generic drugs or a pill injection that can, be taken at home instead of in your physician's office. If you can get a mail subscription, if you can have your drugs mailed to you instead of having to go to the pharmacy, or maybe the doctor has another option that would be available to you. Talk with your PCP. Get to know him or her well. Speak with them and build a relationship. It will be vital, not just for your healthcare needs, but also for your financial needs. If you have an HDHP, trust me, you can run into some very, very large out-of-pocket expenses quickly with these plans. And it becomes even more dangerous if your HSA isn't properly funded. So here are some fast tips to help you deal with HDHPs. Just look at this with a calm eye and a calm mind, and just go over the points carefully. Read your plan documents. Read them again and again and again. If there's something you don't understand, contact Human Resources or contact your insurer to see exactly what they're talking about and what this plan's wording means. Over the years, I can't tell you how many numbers of people I've seen that they just got tripped up in the wording of the summary plan description. They just got tripped up, and then next thing they got some very, very unpleasant financial news because they started running up huge out-of-pocket expenses. Read your plan's descriptions and read them again. Make sure, once again, that you keep your explanation of benefits from your insurer. Keep them in a safe place and read them. Not just keep them, not just take the mail and put it in a box somewhere or something, but actually read the statements and see what they're saying. They can teach you a lot about how your insurer operates, and if you know how your insurer operates, that can be of great benefit to you. Find out what your plan covers. Very, very important. Know intimately what services your plan covers. Know what things they pay for. Know what things they don't pay for. It's easy to find out too. The insurer will be more than happy to tell you. It's not as difficult I know you hear on the TV shows with the talking heads and complaining people and all that stuff. And they say, well, it's difficult to find things out. No, it's not so difficult to find things out if you just take the time and just ask people. Ask the insurer. If you need to have a procedure done, ask them. Very simple procedure, very simple step. And they 99.999% of the time will answer you. Lastly, make sure that you do your preventive visits. Make sure that you do your checkups. Make sure that, you take care of yourself. As I say at the end of the show, take care and be well. Yeah, I mean that literally. And your PCP can help you do that. Make sure that you understand your relationship with him or with her. That concludes what I have to say about high deductible health plans for today. They can be quite complicated, but like I said, if you read your summary plan description, ask questions, be focused. Remember, you are your own best advocate. You have to stand up for yourself, and you have to understand what's going on around you. And you don't want to just toss it off to somebody else and say, oh yeah, well, you can take care of this, or you'll figure it out, or no, that's not going to work. With high deductible health plans, you can get into a lot of trouble in a financial sense really quickly. So you don't want to do that. If you like what you've heard so far, please subscribe, like, and comment. Thank you for your time. Take care and be well.